Is there any chance my placenta previa will resolve on its own?
Actually, yes. The earlier in pregnancy that your placenta previa is diagnosed, the more likely it will be to resolve by the end of your pregnancy. Sometimes as your uterus gets bigger throughout pregnancy, it increases the distance between your cervix and your placenta, which can get rid of this condition. But if it doesn't resolve on its own by the end of pregnancy, you will have to get a C-section.
What activities should she avoid performing for the rest of pregnancy?
You should avoid having intercourse, douching, tampons, and exercises like running or jumping. These activities could all possibly cause you to have contractions, which would not be good, and it is important to let your body rest and take it easy with placenta previa.
Okay, thank you.
Thank you. You're welcome, ladies. Any other questions? Nope, I think we're okay right now.
So what if we want to get pregnant in the future?
Having this one time does increase your risk of developing again. So if you were to get pregnant again, we would just place you as a high risk pregnancy and keep an extra eye on you.
So I heard that falling increases your risk of placental abruption. Is that true?
Yeah, it's not just specifically falling, it's just any sort of large trauma to the abdomen. Some things you can do to avoid falling, I know it's hard since you are pregnant. Wear shoes with a grip surface and avoid high heels. Utilize the handrails on the stairwell and other safety devices like that. Try to avoid carrying heavy things up the stairs or even just around, and try to walk on level surfaces as much as possible. With like the trauma aspect, always wear your seatbelt in the car. That will help. If you do fall, call your doctor right away and seek medical help.
Okay, thank you.
Did you guys have any more questions?
No.
Okay, thank you.
Hi nurse, so I'm in today because my sister had placenta
Percreta.
percreta,
Okay.
and I'm just wondering, how do I know if I have it too?
Okay, so placenta percreta is not typically found until the time of delivery, but it can sometimes be found in a routine ultrasound. C-section deliveries and being over the age of 35 put you at risk for placenta percreta. Bleeding during the third trimester is the biggest sign, so if you're experiencing any bleeding at all, you should come in right away and get checked out.
Okay. She also is not able to have kids now because she had a hysterectomy after her C-section. Is that common?
Yes, so placenta percreta happens when the placenta grows into the full thickness of the myometrium and invades the uterus. Because of this, the patient will then need to get a C-section, where they will then perform a hysterectomy after, if it is severe enough to help with the severe blood loss that is occurring.
Oh, wow. Okay, so today we're going to do an ultrasound to see how your pregnancy is coming along. Oh, this is saying that you have placenta creta.
What's placenta percreta?
It's a condition when the placenta grows partially into the uterine wall, but it's not completely invading the muscle.
What does this mean for the rest of her pregnancy?
So we're just going to have to keep a close watch on you, and you're also going to have a C-section, so we can help schedule that today. And so we'll just schedule some more follow-up appointments today and monitor you closely, and everything should turn out okay.